Hi, this is my final project for Nursing 443. My instructor is Linda Strickland, and the assignment is creating a culture for utilizing research and sustaining evidence-based practice. My article was titled Obesity and Pregnancy, a study of the impact of maternal obesity on NHS maternity services. And NHS is the National Health Service, and that is in England. The authors of this uh, study were N. Hazelhurst, R. Lang, J. Rankin, J. R. Wilkinson, C. D. Somerville. The study was conducted in 2005 and it was actually published in 2007. The problem was obesity in pregnancy and complications that can occur for both mom and baby, and this includes during pregnancy, during labor, delivery, and also postpartum after the baby is born, and what can happen to baby not only in utero but also after the baby is born. So obese women have a much higher health risk for themselves, but also it can affect their baby, cause increased medical costs, and the prevalence of this is increasing astoundingly. So it is something that needs to be looked into and probably more research conducted. The impact of maternal obesity on maternity services is identified by healthcare professionals who are caring for the obese women in the northeast region of England. So that's who was actually studied during this process. The topics that were covered, or the themes as they are referred to, are local service provision implications, whether hospital or community-based, any additional care and cost implications to the service providers, existing policies or guidelines within the unit specific to maternal obesity, any difficulties encountered in carrying out day-to-day care, multidisciplinary services available, and patient information and advice provided to mothers who are obese, or just basically education. Purpose and research questions were related. They were designed to prove increase of healthcare costs of obese maternal patients and health risks that they and their babies have. The qualitative method was appropriate. There was no comparison. It was just straightforward and it had a purpose. So the study was appropriate. There were multiple journal articles, and there were both qualitative and quantitative. They were actually, some of them were specified in the title, whether they were qualitative or quantitative. The studies were, or the journals that were used in reference were anywhere dating from 1991 to 2005. The preamble for the World Health Organization was actually taken as a reference also, and that was actually done in 1946. So that was the most lengthy period of time, I guess. The earliest, I guess, study that was taken. So if you go by that date, the range of dates was from 1946 to 2005, which was quite lengthy. There was a variety of disciplines used, or healthcare providers used during the study. There were midwives, consultant obstetricians, specialist registrars, dietitians, physiotherapists, specialist nurses, clinical ward and service managers, and community practitioners. All information and references were obtained from CINAHL journals. The World Health Organization was the only one that was a reference that was not a, so to say, journal, I guess. This methodology allowed for a richer data source than a quantitative study could have obtained. That was actually taken from the study. So that is what they found, that this type of a study, the quantitative was better, the qualitative was a better study than a qualitative would have been. I said that backwards again. The qualitative was better than the quantitative could have been. There is an absence of studies addressing the psychological impact of obesity, and that is something that is discussed in this study. how they need to focus more on that in the future. Uh, there was certain equipment that was not available to certain healthcare providers. If some of the midwives went out in the field to do their maternal checks or their follow-up appointments, then they had to rely on patient scales or even no scales at all, and they had to go on just information that they had or maybe faulty equipment for calculating BMIs. Um, Early interviews could have influenced later interviews in terms of what could have happened was the people that were doing the interviewing, if they had to elaborate with later interviews, they could have referenced some of the earlier interview answers um, to get more information. So that could have hindered or been a little bit biased as far as that goes. Um, the author was able to prove that there is both an increased health risk for mom and baby due to obesity. Um, the things that affect mom uh, during during pregnancy when they are obese are pregnancy-induced hypertension, gestational diabetes, thromboembolic complications, um, and for baby, they can include macrosomia, shoulder dystocia, late fetal death, and congenital abnormalities. There's also increased complications during labor. There's more expense with recovery complications. Um, there's more prevalence in recovery. Uh, I'm sorry, I said that in recovery complications, but there's more operative and induced pregnancy deliveries. So there's more inductions that are needed because of the complications during labor. Um, it's also found that there is a much higher need for patient education in obesity. This was touched on a little bit earlier. Um, there is a faux pas. Women don't like to talk about their weight. They don't want to discuss it. Many providers are very harsh when it comes to telling patients that they are obese, and it can be very misconstrued by the patients. They can really have hard feelings. They'll change providers a lot of times. We see that a lot of the clinics that I work in. They don't want to hear it, and this needs to be something that needs to be focused on prior to pregnancy. That is one thing that the study found was uh, you really don't want to tell a pregnant woman to go on a diet because that's not the best time for them to actually start dieting and start trying to lose weight. They can monitor their diet and eat healthier and exercise, but during pregnancy, that's not the best time. So things need to be done prior to pregnancy so that this can um, be under control when they do get pregnant. Um, the perspective used for the study was from the provider's viewpoint, so it does show that complications and costs are increased in pregnancy for obese patients. Uh, the information was obtained by questionnaires and semi-structured interviews, and it was a grounded theory approach. Uh, the authors developed what they called category systems independently to enhance validity of the findings and to remove the potential for researcher bias. Uh, there were 5 themes, uh, as you as it was discussed in here. They were referred to as themes that were frequent during the interviews. So things that they found often were the booking of appointments, equipment, care requirements, complications and restrictions, current and future management of care. So those are the things that they found that were repeated in the studies. Um, the naturalistic approach was used because there were semi-structured interviews with the providers. A grounded theory approach was used, as I stated earlier, and according to Burns and Grove 2009, the theory explores how people define reality and how their beliefs are related to their actions. Reality is created by attaching meanings to situations. So this was seen in this research study. The study did result from interviews of providers, and they explained their beliefs along with facts. Their beliefs were more related to the psychological effects of obesity because not many studies have been done regarding this issue. So that's where more of the feelings came in and how they felt that it was not studied enough, and there were some really touchy subjects with that. Uh, the people that were selected were basically anyone that works with maternal health care in the Northeast region of England. Um, all sites in Northeast region of England, it does fit the needs of the study because it was regarding maternal care and effects of obesity. So that is who cares for the patients. Um, any staff um, that were in the area in maternal care was asked to participate. There were actually 33 healthcare providers involved. None of them backed out. None of them, they all completed the study. They all, they all accepted and continued the study to the end. So uh, the the people that were involved were there were 5 heads of midwifery, 11 clinical midwifery managers, 8 midwives, 5 consulting obstetricians, 1 physiotherapist, 1 dietitian, 1 obstetrics specialist registrar, and 1 diabetes nurse specialist. The confirmatory focus group uh, consisted of 1 dietitian, 1 pediatrician, 1 general practitioner, and 1 head of midwifery. Um, Again, with this group, there were no persons that started the study that did not finish. And um, the interviews and focus groups were used. It was the best way to get the unbiased information for the study on this particular patient population. The semi-structured interviews were done between March and October of 2005, and so it was about a 7-month period. Semi-structured interviews were conducted with the members of the staff, and a confirmatory focus group was used after the completion of the first set of interviews to make sure the themes were all covered as needed, and the confirmatory focus group actually consisted of providers that were not very well represented initially. There were no real benefits or risks to participation because they did not involve the patients directly. They were the providers that cared for them. So there were no hurt feelings. There were no, no patients becoming upset. They were, again, it was the providers. So they were just able to give adequate information without having to harm any patient's feelings or anything like that. The interview transcripts were analyzed by systematic thematic content analysis of semi-structured interviews. This information that I'm discussing now was obtained from the journal article. So this uses a category system and is adapted from the grounded theory approach. Each of the 2 authors designed them separately to make it more valid and remove chance of researcher bias. The 2 independent category systems were evaluated and compared, and a final category system was produced after being approved by both researchers. There was a 3rd independent researcher who was not familiar to the research. This researcher was asked to develop a category system. The final system was adjusted as needed so that it ensured all topics were covered without bias. Each transcript was coded using the final list of category headings against full statements. The coded transcripts were checked individually for miscoded statements and continuity of data interpretation. The coded statements were then grouped into broader categories, which identified the returning themes. Copies of transcripts were kept to ensure the key themes were identified and remained in context, and the confirmatory focus group was utilized to check the saturation of the themes had occurred. So basically that both groups were able to cover all information necessary in the study. The research method did meet the purpose, and the findings did address the reason of study, which was complications during pregnancy and after pregnancy. The data was sufficiently analyzed except for the education and psychoanalytical aspect. So interpretations did match the data collected, and there were no there were not many variations in the data collected. Everything was pretty much across the board. So this study was a good study. It gave me a lot of information, and it makes me want to do more research on education of obese patients and get them educated prior to becoming pregnant. And there's a need to identify patients that are wanting to become pregnant and see where the education can begin. This concludes my study and my assignment. I have enjoyed this course, and I hope that you enjoy my presentation. Thank you.